Good morning, everyone. Thank you for being here. We're very honored to have some very special guests with us today. Maureen Murphy, Denise White-Jennings, and Emily Todebush. You'll be hearing from them. They're our VIPs, our very important people. So we're honored to be joined by them. We're understanding that the Republicans want to press forward with their latest version of Trumpcare. As they do so, they are threatening devastation in the lives of America's families. The latest Republican plan to gut essential health benefits and protections for pre-existing conditions will make it impossible for millions of Americans to afford the health coverage they desperately need. This is deadly. This is deadly. Trumpcare means heart-stopping premium increases for Americans in anything from asthma to cancer, and the list goes on along the alphabet. And no Band-Aid amendment will fix it. If Republicans have their way, Americans with pre-existing conditions will be pushed off their insurance and segregated into high-risk pools where they face soaring cost, worse coverage, and restricted care. Soaring cost, worse coverage, restricted care. It's a frightening future for families who need affordable, dependable health care the most. The fight against Trumpcare is a fight for children. You've heard me, many of you, talk frequently about Zoe Madison Lynn, born with a congenital heart defect in May 2010. Zoe faced her first of 3 heart surgeries at age 15 hours. By 6 months old, Zoe was halfway to lifetime limits her insurer placed on her care at 6 months old. She faced a grim future, not only using up her lifetime limit by preschool, but carrying a pre-existing condition that will require attention and care for the rest of her life. Under the Affordable Care Act, Zoe is protected. Under Trumpcare, has put Zoe's future in very serious danger. The Trumpcare means, again, that just even before we get to the pre-existing condition catastrophe that they're foisting, Trumpcare means higher out-of-pocket cost for American families, more than 24 million people losing health care coverage, gutting key protections, a crushing age tax if you're 50 to 64, and stealing from Medicare. Republicans offer to raise health care for America's families must end now. This is about health care being a right, not a privilege, just for the wealthy who can afford it, but for everyone. It's time for the Republicans to abandon their moral monstrosity and pull this bill. Thank you. But let me say this about their latest, because every time they're in jeopardy of passing their bill, they make matters worse. They have this bill, which, as I said, increased cost, eliminate 24 million people, age tax, and the rest. And the list can go on and on. I just named a few of the few areas of unfairness to America's working families. So then that was 56% of the public were against that, 17% were for it. So they were going to lose the vote. So they moved to the right and placed in jeopardy the essential benefits package. That's a terrible thing. And when the American people saw that, they not only disagreed with their bill, they disagreed with their values about children and Medicare, maternity care, prenatal care, the list goes on. Now they don't have the vote, so they're going further to the right, and they're making it look like this is some kind of a compromise. But this is really just duping. They think they can dupe the American people by saying, well, we were going to eliminate pre-existing conditions, but now instead we're going to give you $200 if you have a pre-existing medical condition. Please. With that, I'm pleased to welcome a champion for health care for all Americans as a right, not a privilege, a person who will tell her story and why she's such a fighter for health care, the ranking member on the Health and Human Service Subcommittee of Appropriations, a co-chair of our steering committee, a member of our leadership, Congresswoman Rosa DeLauro of Connecticut. Congresswoman.
thank you very much, Madam Leader, and good morning to all. I want to thank the leader for her always championing the cause of everyday Americans, and in this particular fight for health care, which she has been steadfast the last several years, and making sure that we do have an affordable health care effort today. I'm glad to be joined by my colleagues, and especially to say welcome to Maureen, to Denise, and to Emily. We are so grateful that you have stood up to share the impact of the Affordable Care Act and the impact that it has had on you and your families. There is a reason the Republican health care bill went down in flames when they tried to bring it up on the floor several weeks ago. It would have raised premiums and deductibles. It would have imposed an age tax on older Americans, making health care unaffordable. It was reckless and it was heartless. But then the Republicans went back to the drawing board, and their new proposal makes a bad bill worse because it unravels the protections for patients with pre-existing conditions, and it eliminates coverage for essential benefits. President Trump's claim that people with pre-existing conditions will be covered is false. It is plain false, and it has life-threatening consequences for millions of Americans, including some in this very room. And before we pass the Affordable Care Act to put doctors and patients back at the center of health care decisions, insurance companies would revoke care for people with pre-existing conditions, or they would charge them exorbitantly. But because we passed the Affordable Care Act, Americans who have a pre-existing condition or their children who have pre-existing conditions can now get the health care they need to survive. Take a cancer survivor. Because of the Affordable Care Act, they cannot be discriminated against because of having cancer. It goes further. Because the insurance they get through the Affordable Care Act includes coverage for preventive cancer screenings, prescription drugs, covers young adults up to age 26, and does not have annual or lifetime caps that the leader spoke about. The same goes for people with diabetes. They do not just benefit from protection for patients with pre-existing conditions. They have the benefit from copay-free screenings, annual wellness visits, and drug coverage. For individuals with mental health or behavioral condition or a substance abuse disorder like addiction, those conditions are not disqualifying for high-quality insurance. The Affordable Care Act required the new plans cover mental health services and essential benefits. Instead of increasing costs, we should protect coverage for pre-existing conditions and make health care coverage affordable. I get my health care through the insurance exchange and the Affordable Care Act. That's where I get mine, and where most members of Congress get their health care. I have a pre-existing condition. I am an ovarian cancer survivor. I am covered, and I can pay for it, and I can get what I need. This is a very personal fight for me, and we will continue this fight. For working Americans, the stakes could not be higher. We will keep fighting these attempts to dismantle health care because, as the leader spoke about, this is about people's lives. This is about surviving. And now it gives me great pleasure to introduce to you Maureen Murphy from Virginia, who will share her story with all of us. Thank you, Maureen.
Good morning, and thank you all very much for having me here today. As the Congresswoman mentioned, my name is Maureen Murphy, and I live just over the Potomac River in Alexandria, Virginia. My story, unfortunately, is very familiar to tens of millions of Americans. I experienced a very unexpected and somewhat shocking medical crisis. I had a stroke caused by a rare blood disorder I didn't even know I had. At the time, I was absolutely stunned. You see, I didn't smoke, I didn't drink, I didn't do drugs. I was actually in an exercise class when the stroke happened. Not the typical makeup of someone headed toward a stroke, but nonetheless, overnight my life suddenly shifted away from finishing graduate school and instead was focused on desperately trying to find access to health care and as quickly as possible. What made that so difficult was that I had been denied the ability to even purchase health insurance coverage after the stroke due to a pre-existing condition. Now, I think it's important that you all understand the pre-existing condition that I was initially tagged with was due to my seeking bereavement counseling after the death of my parents. I believe the great majority of people in this country view bereavement counseling as a healthy reaction to loss. Apparently, health insurers see that very differently. Fortunately for me, the Affordable Care Act had been enacted just 8 months before I had the stroke. The ACA's provision that did not allow health insurers to charge more or deny coverage to people with pre-existing conditions became the literal lifeline that pulled me through that very frightening time. Initially, I got coverage through the ACA's pre-existing condition insurance plan, which was a high-risk pool, and it was one of my first steps forward. It was expensive and had pretty high deductibles, but I was so grateful to get that and at least start moving. And then in 2014, that all changed when the insurance marketplace opened and I was able to purchase my coverage through the exchanges, which I have done every year since. There are two critical elements that allowed me to continue to regain my health. First, the medication I take every day to control my blood condition. And secondly, the ongoing protections of the ACA, ensuring I will not be denied access to purchase health insurance again, and that I will not be charged more because of any pre-existing conditions. What the ACA did for me was to give me the tools I needed to get my health back under control and back on my feet, and it worked. But what I have to say this morning, when I came into this room, I did feel strange. I felt like I'd been here before. I was quickly reminded of the time I was here 4 years ago to mark the opening of the exchanges. The cameras in the same place, audience seated the same, even many of the same people standing alongside me are the same. So I have to say, we've been here before. Why aren't we moving forward? Why are we going backward? Why would anyone want to diminish the quality or access to health care we've been able to create? 24 million Americans rely on the ACA to provide access to their health care. Why aren't our representatives working to refine the ACA and make it better for all of their constituents? The Republican Party voted to repeal the ACA 60 times at a cost of $87 million. Imagine if they had put that money and effort into making the ACA better for the American people who desperately needed access to health care. There are millions of people, like in my home state of Virginia, who are trapped in the coverage gap because Republican politicians refuse to expand Medicaid. These hardworking, tax-paying individuals, many working 2 and 3 jobs to make ends meet, and yet they are blocked not by insurers, but by politicians. If the Republicans pass this health care bill, not only will I lose my access to health care, but thanks to the latest version they're considering, I may not ever be able to get it again because I have a pre-existing condition. And I can assure you the consequences for me are quite dire. The bill Republicans are pushing right now would also strip away Medicaid for millions and also put million more seniors, people with disabilities, and children at risk of less coverage at a higher cost. So again, I have to ask, why are we going backward? The American people are not stupid, and they are not callous nor heartless, but most of all, they are not foolish. I just hope the House Republicans listen to the people who elected them, not their leadership, and do the right thing for their neighbors, their friends, and their constituents. For many people, like me, this is about life and death, and that's not hyperbole. It's terrifying. So, thank you very much for listening, and now I'd like to introduce Congressman John Yarmuth of Kentucky.
Thank you. Thank you very much, Maureen. The question we have to ask today is, who in the world is better off because of this new version of the American Health Care Act that we are supposedly going to consider? I'll tell you who is better off. The few politicians in the Republican conference who need to have a vote for political reasons. I'm not making that up. Budget Director Mick Mulvaney made the same comment just a couple of weeks ago when he was asked, why so much pressure to get this done? And his first response was political momentum. The second response was so we can do tax reform. There was not a reason that was related to anybody's health. And that's why we're here today, because we're concerned with the health of the American people and creating a system that most effectively and efficiently takes care of them. Now, who in the world as a patient going to be helped? We've heard from Maureen, we'll hear from others. I'll tell you about Anna Riggert, a young woman from my district who is 23 years old, was diagnosed at age 12 with pancreatitis. Her parents had coverage. She was covered under her parents' policy, and she was hospitalized 24 times since then, between age 12 and now. Her father was so grateful when the Affordable Care Act was passed because he knew that with that in place, when she turned 26, she would never have to worry about being insured again because she clearly has a pre-existing condition that would have made her uninsurable. Well, last year, Steve Riggert, her father, at 64 years of age, was diagnosed with pancreatic cancer. And now, as he faces the last term of his life, he's worried again that the safeguards that were in place to protect Anna will disappear. She is one of 880,000 people in my state of Kentucky who would have been denied coverage before the Affordable Care Act because of a pre-existing condition, 33% of our non-elderly population. So the answer that the Republicans have put up is we're going to create high-risk pools, let the states do that, something that's been tried, something that has failed miserably, and something that, according to the Kaiser Family Foundation, would result in, for instance, a breast cancer survivor in Kentucky having her premiums raised by $26,000 a year. This is not an answer to our health care problems. It is an answer to Republicans' political problems. We need to react and remember that outside of this building, people's opinions have not changed. I suspect there's still 17% approval for this concept. We know the doctors still oppose it, the hospitals still oppose it, the nurses still oppose it, and every patient advocacy group in the country still opposes this. So this is a horrible idea that is being considered only for political reasons, and we need to stop it. And now, with another story that we can't wait to hear, I'd like to introduce Denise White-Jennings.
Thank you. Good morning. I'm very glad to be here today to share my story. It's actually my daughter's story. I hope that stories like my family's story and that of others here will weigh on the Republicans' minds as they are deciding about whether to vote for this awful health care bill. I hope it makes them prioritize people over political capital. My name is Denise White-Jennings, and I'm from Upper Marlboro, Maryland. I'm speaking today as the mother of a wonderful young woman who was diagnosed with thyroid cancer in her sophomore year of college. The diagnosis was devastating and unexpected. We're vegetarians, we exercise, we eat healthy. But fortunately, it was not financially devastating because we were fortunate that she was on our health insurance plan when she was diagnosed, and she could remain on our plan until the age of 26 because of the Affordable Care Act. So her daily medication that she has to take to replace the essential hormones that were lost because of the removal of her cancerous thyroid and gland, the regular follow-up blood work that she has to have periodically, as well as full body scans that she has to have every few years to ensure that she remains cancer-free, continue to be covered because of the Affordable Care Act. When her 26th birthday approached last February, we became extremely anxious because we knew that she would soon need to seek out her own insurance, and if the Republicans passed that bill, she would be uninsurable. So her father, as well as my daughter, determined that we didn't want to return to those days when she would be uninsurable, when they were denied health insurance and couldn't access treatment to keep them healthy or even alive, when people like my daughter would not be able to get insurance. So my daughter is lucky because she's cancer-free, she's healthy, She's pursuing her dreams of being a lawyer. She was also lucky that when she turned 26, the Affordable Care Act is still in existence. And we were able to extend her coverage through her present plan and pay for that insurance, and so that she could keep her same doctors and have continuity of care. And although she's covered through Yale Law School, my husband and I, we did elect to purchase that additional care with Kaiser so that there would not be a break in her coverage, hoping that that would lessen the possibility of her being kicked off of a plan or charged higher premiums if one of these awful Republican bills does pass. We want an insurance company to look at her and see a healthy, beautiful young woman, not to only see cancer. No parent should ever have to fear that their child's future or life might be at risk because health care is unattainable or unaffordable. So here's my message today to the Republicans in the House. Let's not return to those days. A growing number have voiced their concern and their opposition. So please place concern for the well-being of families over the well-being of your careers. Don't cave in to the political bullying that seems to be occurring in a rush to replace Obamacare, the Affordable Care Act, at all costs, because the human cost is too high. If you must replace the Affordable Care Act, to improve it, hold out for a bill that's going to protect our most vulnerable. And to the rest, have the courage to do what you know is right, to make sure that no one's future is clouded by being denied health insurance. Work constructively with your colleagues of both parties to improve our health care system, not to destroy it. Thank you. And I would like to introduce Representative Scott.
Thank you. Thank you very much. We know that the Affordable Care Act has made an improvement. We've heard those stories one after another. We know that although the costs have gone up, they've gone up at the slowest rate in 50 years. We know that people with pre-existing conditions can buy insurance at the standard rate. We know women are no longer paying more for insurance than men. And we know that instead of millions of people losing their insurance every year, when we pass the bill, 20 million more people have insurance. The full name of the Affordable Care Act is the Patient Protection and Affordable Care Act, and they're patient protections, like no caps on benefits. We're closing the donut hole. We're prevention and cancer screenings, no copays and deductible. Those up to 26 can stay on their parents' policies. We have essential benefits that include mental health. We're funding community health centers, and we're putting money into education so that we can produce more doctors and nurses. Still, there's more work to be done, but if we're going to make a change, we should improve the Affordable Care Act, not make it worse. The Republican bill makes it worse on every measure. For example, costs will go up. The average typical family, about $2,000 a year. For the older American, as much as $7,000 a year. We know that 24 million Americans fewer will have insurance. We know that the quality of the insurance will go down. Costs go up, quality goes down, 24 million people lose their insurance. We found just yesterday there's another benefit of the Affordable Care Act, and that is that personal bankruptcies are down about 50% because people aren't going bankrupt because of health care costs. Now, one of the most important aspects of this is the one that's most at risk, and that is the protection against pre-existing conditions. We know that you can't have a health care plan that allows people to wait until they get sick before they buy insurance, because people will wait until they get sick before they buy insurance. The average goes up. Fewer people can afford the insurance, so they drop out. Their costs go up. Healthy people will drop out. Sick people have to have the insurance, so they'll pay whatever it costs. There's a name for this process. It's called the death spiral. New York was in the death spiral when we passed the Affordable Care Act, and when the bids came in with the Affordable Care Act mandates, the costs for individual insurance dropped more than 50%. Washington State tried to cover people with pre-existing conditions without a mandate, and after about 3 or 4 years, nobody could buy insurance. It had spiraled out of control. The idea of high-risk pools have been notorious failures. First of all, we need to, always need to subsidize these. If you're going to have more money in the plan, why don't you put it into subsidies in the present format? Everybody's rates can go down. You can increase the cap on those getting subsidies. So there are other ways of dealing with subsidies. But what is the pre-existing condition? Who gets shoved over into the high-risk pools? Are there caps? There are always caps, so you have worse insurance and the premiums are going to be higher. That is not a good plan. That is not an improvement. We can do better. So if we're going to have any changes in the Affordable Care Act, we should not go backwards. We're going to hear another story from Emily Totenbush, who will tell us the reason on a real-life basis why we need to keep making progress and not going backwards.
Good morning, and thank you for having me here today. My name is Emily Totenbush. In July of 2012, I was offered a great job after months of being underemployed. Like many people my age, I risked not continuing COBRA coverage for the 90 days until my new insurance kicked in. I thought, I'm healthy. What could possibly go wrong in 90 days? Little did I know, that decision would be the worst mistake ever. In October of that year, I had a very specific pain behind my right eye. The pain persisted and became almost unbearable. But I thought to myself, only a couple more weeks, you'll have insurance. The eye pain did not go away, but instead was compounded by numbness and tingling along the right side of my body and a difficulty walking that resulted in a fairly embarrassing tumble down the stairs in front of hundreds of people. Once November 1st rolled around, I had my appointment with my doctor, and that began the countless appointments with specialists, only to be diagnosed with a relapsing remitting course of multiple sclerosis at the age of 27. I was devastated. In my first year of care, my insurance was billed over $100,000. That's important because the speaker mentioned lifetime caps. MS is a disease that is unpredictable. I manage it by taking a disease-modifying drug that without insurance would cost $6,800 a month. I manage it because I have access to wonderful doctors and care. And I am able to have insurance because of the Affordable Care Act and the leader, Pelosi, and her Democratic colleagues in protecting it. Without insurance, MS would have the ability to destroy my central nervous system, not quickly, but slowly, something that is both agonizing to experience and watch. MS does not just affect me, it affects my loved ones as well. I did not ask, nor did I do anything to provoke this disease. It chose me at random, like it does countless others just like me. So it's painful when I see elected leaders such as Congressman Mo Brooks, who are trying to take away health care, say that we got sick because we didn't take care of ourselves, or as if people got what they deserved. No one deserves to get sick, and health care is a basic right. I speak out about the importance of health insurance, not to point out how sick I am, but to point out how sick I am not. We are faced once again with the possibility of Republicans in Congress playing games with our health care, and we are not laughing. This bill will have disastrous effects for people just like me who are faced with a pre-existing condition, allowing states and insurance companies the option to extend us the right to health care. Should this bill pass, my premiums will skyrocket, causing my insurance to be unaffordable, and my plan could easily become restrictive, preventing me from getting the care and medications that I need to maintain my current health. Today, I stand before you, a healthy, active, 32-year-old woman with her life ahead of her. I am somebody's daughter, sister, aunt, friend. If multiple sclerosis can happen to me, I assure you it can happen to absolutely anybody. Thank you. It is now my honor to reintroduce Nancy Pelosi.
Thank you very much. Thank you, Emily. Thank you, Emily. Thank you, Denise. Thank you, Maureen, for sharing your stories with us. And I also want to acknowledge the leadership of Bobby Scott and Mr. John Yarmouth, because they are ranking members on the committees of jurisdiction. They, along with Richie Neal of Ways and Means and Frank Pallone of Energy and Commerce, have been relentless in their leadership and spelling out what the consequences are, suggesting a better way. So I thank you, my ranking members, and Congresswoman DeLauro, wearing so many hats here, including, more important than all, a person with a pre-existing condition willing to share her story. And by the way, the Republicans have decided, when they started with their bill, that they would exempt themselves from any of the negative provisions of this bill. Imagine that. But let me just say a couple of things as we go forward, because the most compelling statements we have here from the experience that Maureen and Emily and Denise, as relating to her daughter's story, have told us. But one of the reasons they're in a hurry is because they need this money to give a tax break to the wealthiest people in our country. This bill will have the biggest transfer of wealth in the history of our country, Robin Hood in reverse, taking from the middle class and working families in our country and $600 billion and giving it to the wealthiest people. Now, that is the goal of their tax bill, but they need this money from your health care in order to do that, A. B, they're rushing it without a CBO report, a Congressional Budget Office report, which they themselves have said never should happen. I have a letter from the Speaker when he was chairman of the Ways and Means Committee to the CBO's office saying, don't let them go forward with a bill unless you have a CBO report. And yet they're doing that now. Dr. King, he said so beautifully, of all of the forms of injustice, the injustice of healthcare is the most inhumane and shocking, because people can die. Because people can die. How many times have all of us traveling the country or in our personal experience have heard people say, my child would not be alive, my wife, I would not be alive without the Affordable Care Act. So now they, again, in order to get votes, have made matters worse. Terrible bill, made worse by putting in doubt the essential benefit package, and now a hoax on pre-existing conditions. Pre-existing conditions. Pre-existing condition. That is something that is can be so devastating in depriving people of access to insurance, but also the cost of it all being so, as Congressman Scott mentioned, what happened in Washington State and the rest. So this is a very important moral truth. They are not legitimate. They have put this forth to make it look like, oh, we've improved the bill. No, it doesn't improve the bill. And this is an insult to the intelligence of the American people, but worse than that, it is an assault on the good health of the American people. With that, I'd be pleased to take a couple of questions, if anybody has any. No questions? Yes, sir? Back there? Hi.
Just yesterday...
But the group would I know who you are, but they want to know who you are.
Mike Willis with the Hill newspaper. And the whip counts that everybody's keeping, the Republicans seem right at the brink, and it's still unclear if they're going to bring this to the floor. But there was a meeting at the White House this morning, and Mr. Upton is now a yes. Are you hearing anything new about whether or not this bill will be voted on this week?
With all the respect in the world for Mr. Upton, he's always been a yes. He's always been a yes. So what can I say to you? People will say, well, I'm a no, okay. Give me some fake reason why I should be a yes, and it'll make it look like the bill's better. Mr. Upton's always been a yes.
Are there any communications between you and the Speaker's office about vote scheduling?
No. No, well, my staff to staff, they may be talking about scheduling. But what the communications we are receiving are from the American people calling into Congress and saying, stop this the bill is terrible to begin with. But the assault on the pre-existing condition, this was there are two things, many things in the Affordable Care Act, but two things that have made a total difference in the lives of people who may have a diagnosis. One is that a pre-existing medical condition will not prevent you from receiving insurance, and also that you can afford it. And two, that the lifetime limits do not affect how you, as I mentioned about Zoe Madison Lynn, how that impacts what care you get. And to say that seeking bereavement counseling is a pre-existing medical condition, they will say a woman who has been the victim of domestic violence has a pre-existing medical condition. So this pre-existing medical condition is central. It affects over 125 million people have a pre-existing medical condition. The reason healthcare professionals, nurses, doctors, healthcare providers at community health centers and in hospitals are against this is because everybody they deal with has a pre-existing medical condition. So again, Dr. King, because people will die. Any other question? Yes, sir.
Scott Decker with NPR.
Excuse me, does anyone else have anything they want to say on that subject? Okay.
I know you've been talking a lot generally about this, but just curious what your specific response is to the idea that an $8 billion pool would help offset the cost for people in these new high-risk pools.
Thank you for answering that. Our ranking member on budget spoke to that. I'm going to yield to him in a moment. But first to say this. What you would need is probably about $200 billion over 10 years. What they have done is $8 million over 5 years. If you divide that by the number of people who have a pre-existing medical condition, you get about $200 or $300 a year. Look at the Kaiser Family Foundation. Look at some of the experts on this subject. It's a joke. It's a very sad, deadly joke. Yield to the distinguished ranking member on budget.
I would only add that the history of high-risk pools is pretty discouraging. Before 2011, there were 35 states that had high-risk pools. They only insured 226,000 people. Most all the states had high caps on annual and lifetime limits. The premiums were 150 to 200% of what the standard rate was in those areas. So the experience, by and large, has been terrible. I know in California, the leader can speak to this more fully than I can, but I think 1 out of 6 people who tried to get into high-risk pool in California were actually able to get into it. And all of this state flexibility depends on governors and legislatures that are compassionate. I have a governor who, despite the fact that Kentucky has insured more people as a percentage than any other state in the country, has reduced its uninsurance rate from 20% to 7%. He wants to dismantle the whole system. So I'm certainly not willing to say that allowing state flexibility for my governor to take care of the 880,000 people who have pre-existing conditions, non-elderly population has pre-existing conditions, I'm not going to trust him to be willing to take care of that. And I think you'll find that in many of the states that we're dealing with.
Any other questions? Well, once again, I want to thank our guests, Maureen Murphy, Denise White-Jennings, and Emily Toda-Bush, as well as our ranking members, Mr. Scott, Mr. Yarmouth, and our leader on this subject, Congresswoman Rosa DeLauro, and thank all of you. This is about life and death. This is about who gets the money. And that's what you always have to look at the Republican bills. It's always about follow the money. And this is about money going into the pockets of corporations and the richest people in our country at the expense of the good health of the American people. Thank you all very much.
Yeah.